Welcome to Health and Fitness, where we bring you life-saving insights for a healthier tomorrow. Did you know that your body might be sending warning signs of a stroke as early as a month before it happens? In today's video, we'll uncover 9 critical symptoms you need to watch out for and how detecting them early can save your life or the life of someone you love. Stay with us till the end, because this information might be the most important thing you learn this year. Understanding stroke, a silent killer. Every 40 seconds, someone experiences a stroke, making it one of the leading causes of disability and death worldwide. But here's the good news. Up to 80% of strokes can be prevented with timely action. Before we dive into the symptoms, let's quickly understand what a stroke is. A stroke occurs when blood flow to a part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. This can happen in 2 main ways. 1. Ischemic stroke, caused by a blockage which accounts for 87% of cases. 2. Hemorrhagic stroke, caused by a burst blood vessel. Regardless of the type, the outcome can be devastating if not addressed quickly. Symptom number 1, persistent fatigue or sudden weakness. The first early symptom is persistent fatigue or unexplained weakness, especially on one side of the body. You might feel like your arm or leg is unusually heavy or hard to move. This happens because your brain isn't getting enough oxygen, causing certain areas to work inefficiently. A study revealed that 30% of people who suffered a stroke reported unusual fatigue weeks before the event. If you or someone you know experiences this, don't brush it off as just being tired. It could be your body's early warning system. Symptom number 2, vision changes. The second symptom is sudden vision changes. This could mean blurred vision, double vision, or even temporary loss of vision in one eye. Why does this happen? A stroke can affect the part of the brain responsible for processing visual information. According to a 2024 report by the American Stroke Association, vision disturbances are among the most overlooked early signs of a stroke. If you notice these changes, especially if they come and go, consult a healthcare provider immediately. Symptom number 3, trouble speaking or slurred speech. Next, let's talk about speech. Difficulty speaking, slurring your words, or even forgetting simple words can be a major red flag. This symptom, known as dysarthria, occurs when a stroke affects the areas of the brain responsible for language. Don't wait for this symptom to become severe. In many cases, these subtle speech issues can appear intermittently in the weeks leading up to a stroke. Symptom number 4, frequent dizziness or loss of balance. The fourth symptom to watch for is frequent dizziness or loss of balance. Imagine this. You're walking or just standing, and suddenly the world feels like it's spinning. You might feel wobbly, lightheaded, or even stumble. This can happen because the part of your brain that controls balance and coordination isn't getting enough blood flow. While occasional dizziness might be harmless, consistent episodes, especially when paired with other symptoms, are a red flag. According to research, more than 40% of stroke patients reported dizziness or unsteadiness in the weeks before their stroke. This isn't just a coincidence, it's an important warning. So, how do you differentiate harmless dizziness from a stroke warning? Ask yourself, 1. Does the dizziness come on suddenly and without reason? 2. Is it accompanied by nausea, trouble walking, or blurry vision? 3. Does it happen more frequently than usual? If you answer yes to any of these, it's time to see your doctor. Don't wait. Symptom number 5, unexplained mood swings or personality changes. The fifth symptom is something many don't associate with a stroke: unexplained mood swings or personality changes. You might feel unusually irritable, anxious, or even depressed for no apparent reason. This happens because the brain areas responsible for emotional regulation can be affected when blood flow is disrupted. Even subtle personality shifts, like increased forgetfulness or trouble concentrating, could be an early warning. Research shows that emotional instability or sudden mood changes occurred in about 25% of patients before a stroke. These changes often go unnoticed because they mimic everyday stress or mental health issues. If you or someone close to you starts experiencing these emotional shifts, take note. Keep track of their frequency and intensity. Early intervention can make all the difference. Remember, don't forget to like and subscribe to Health and Fitness Today. We'll be your trusted partner, offering helpful tips, reliable scientific information, and practical advice to improve your health every day. Turn on notifications so you won't miss any of our new content. Symptom number 6. Unusual sleep disturbances. The sixth symptom we're discussing today is unusual sleep disturbances. If you're suddenly waking up multiple times a night, experiencing restless sleep, or feeling inexplicably fatigued despite getting your usual hours, it could be more than just stress. Why does this happen? When blood flow to the brain is compromised, areas that regulate sleep cycles can become disrupted. This results in fragmented or poor quality sleep. Research conducted by the Journal of Stroke Research found that nearly 50% of stroke patients reported significant sleep disturbances up to a month before their stroke. This is often overlooked, but it's a crucial warning sign. Here are the key questions to ask yourself. 1. Have you experienced sudden difficulty falling or staying asleep? 2. Are you waking up feeling exhausted despite no changes in your routine? 3. Is your sleep pattern worsening without any clear cause? If the answer is yes, it's time to see a healthcare provider. Poor sleep could indicate underlying blood flow issues. Symptom number 7. Sudden loss of appetite or gastrointestinal distress. The seventh symptom is sudden loss of appetite or unexplained gastrointestinal distress. This might seem unrelated to a stroke, but it's not. The connection between the gut and brain is powerful. Reduced blood flow can interfere with signals along the vagus nerve, leading to nausea, loss of appetite, or even indigestion. These signs might seem like minor annoyances, but they can signal something far more serious. According to a 2024 study, over 30% of patients experienced appetite changes or gastrointestinal symptoms before their stroke. These symptoms often coincided with other early warnings. So how do you know when to act? Pay attention to these patterns. 1. Persistent nausea or bloating without an obvious cause. 2. A noticeable decrease in appetite lasting more than a few days. 3. Any sudden digestive changes paired with dizziness or fatigue. The 8th symptom, persistent headaches with vision changes. The 8th symptom is one many overlook. Persistent headaches accompanied by vision changes. While occasional headaches aren't uncommon, those linked to strokes often feel different. They're persistent, more intense, and sometimes accompanied by visual disturbances such as blurred vision, double vision, or even temporary vision loss. What's happening here? These headaches can occur when blood flow to the brain is restricted, increasing pressure in certain areas. Vision changes result from reduced oxygen reaching the part of the brain responsible for processing what you see. A study from the American Stroke Association revealed that nearly 20% of stroke survivors reported experiencing severe headaches with vision problems up to a month before their stroke. What makes these headaches different? So how do you distinguish these headaches from the regular kind? Stroke-related headaches often 1. Last longer than usual. 2. Feel more intense or sharp. 3. Are accompanied by nausea, dizziness, or vision issues. If you notice headaches paired with visual symptoms, it's critical to consult a healthcare provider immediately. These could indicate a transient ischemic attack, or TIA, a temporary blockage of blood flow to the brain. The 9th symptom, weakness or numbness in a single limb. The 9th symptom is weakness or numbness in a single limb. While strokes are often associated with sudden full-body paralysis, early warning signs can be more subtle. You might notice a weak grip in one hand, difficulty lifting an arm, or even numbness in your leg. This happens because strokes often affect one hemisphere of the brain, which controls the opposite side of the body. If blood flow is compromised in the area controlling your right arm, for example, you might feel weakness or numbness in that arm alone. Risk factors and who's most vulnerable. Now, who's at risk? While anyone can experience a stroke, certain factors increase the likelihood. 1. High blood pressure. 2. Diabetes. 3. Smoking. 4. Obesity. 5. Family history of stroke. Keeping these risk factors in check can significantly lower your chances of experiencing a stroke. And remember, even if you're healthy, recognizing early symptoms can make all the difference. Conclusion. Recognizing these 9 symptoms, persistent headaches with vision changes and weakness in a single limb, could save your life or the life of someone you love. If this video has helped you, please like, share, and subscribe to Health and Fitness. Together we can make health our top priority. See you next time.